you may not know this, but June is National Headache and Migraine Awareness Month. This morning, Dr. Katherine Lee from North Kansas City Hospital is joining us. How you doing, Dr. Lee?
I'm doing well. How are you?
Doing pretty good. I used to get headaches all the time. I don't get them as much anymore, but I know people who get migraines it's just miserable. You want to just curl up and stay in bed all day.
That's right.
What's the difference between just for people who've never had a migraine? How bad is it? What's the difference between a normal headache and a migraine?
Sure. So the easiest way to distinguish between what we call a general tension headache and a migraine headache is really the severity of the incident. Tension headaches tend to be more dull, achy, more subtle in nature, whereas migraines tend to be quite incapacitating. One acronym that I like to use to help remember some of the key characteristics of migraines is called POUND. P for pulsatile pain, O for 1 day of duration or up to 72 hours, U for unilateral or one-sided head pain, N for nausea and vomiting, and D is for disabling pain.
Wow. That sounds miserable. What triggers migraines? Is it different for each person?
It is different for each person. It's very unique for each individual. Some of the more common triggers of migraines are genetics. Other things include alcohol, caffeine, stress, certain changes in weather patterns, hormonal changes, and lack of sleep, just to name a few.
I would assume that most people who get them just try to deal with it, especially if they're new to you, and it'll go away. At what point do you say, I need to see a doctor or nurse or somebody? Help me, please.
Yes. So generally, tension headaches and migraines can be managed with over-the-counter medications, but there are a few key features we say, hey, you should really see a doctor. Some of these include if you've never had an issue with headaches and all of a sudden you find yourself having frequent headaches, you should see a doctor. Other things like what we call the worst headache of your life, especially the maximum pain at the onset of a headache. And then some other symptoms to watch out for when you have a headache are unintentional weight loss, confusion, any changes in your vision, fever, and neck stiffness. These can all be signs of a different underlying etiology.
Like a brain tumor or a tumor in your neck or something that, could be deadly?
Yes, on rare occasion, like a brain tumor, brain or spinal cord infection, any sort of blood clot or brain bleed are things that we...
Did you mention blurred vision?
Yes, that is one of the symptoms.
And does that go away or does it stay, could it be intermittent?
It can be intermittent, yep. And it can be one-sided blurred vision or both sides.
Well, Dr. Lee, thank you so much. I did not know that now we're migraine and headache aware because it's the Awareness Month. Appreciate it. Take care.
Thanks for having me.
All right.